I would like to greet just likewise in your language. Sat Sri Akal. Good afternoon, everyone here. Good afternoon to delegates. Good afternoon to dignitaries and my dear students. Myself, Dr. Jaishree Tiwari. I am from Arogyam Medical College, Roorkee, and my place is Dehradun. So, I would like to share, or I would like to make aware about the topic, that is physiotherapy management of ankylosing spondylitis. So students, have you ever heard about ankylosing spondylitis? Are you aware of this word? This is a disorder. This is an orthopedic condition, I'll say. Please, I wanted to make an interactive session, moreover interactive session. So are you aware of this word? No? Okay then. So I'm going to make you aware about it. Ankylosing means fusion. What it means? Fusion. Fusion means judna, right? And if we are talking about ankylosing, that means we are talking about fusion of spine. And I hope you know how many vertebrae are there in a spine. Can anybody tell me? 33 vertebrae, right? So more specifically, if I talk about, we have 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, sacrum is fused. Then we have 4 pairs of coccyx, right? So we are going to, I'm going to make you aware about what is ankylosing spondylitis. Spondylitis means inflammation, right? So we are going to study, I'm going to make you aware about this topic, inflammation of spine. Moreover, more specifically, that is physiotherapy management of ankylosing spondylitis. Now, prior to that, you should know what is physiotherapy. So students, physio means physical treatment given to the patient. In physical treatment also, we have 2 modes, that is exercise therapy and electrotherapy. So exercise means we are giving the treatment to the patient with the help of innumerable technique of exercises, and in modalities we have innumerable machines, right? So I hope my topic is clear to everyone, what I am going to discuss about. Fine? Please say yes, ma'am. Okay, thank you. Fine. So basically, ankylosing spondylitis is an inflammatory disorder of unknown cause, but then also we have one genetic predisposition, means it is an autoimmune disorder, and for that a gene is involved, that is HLA-B27 gene, right? So it's an autoimmune disorder. It's an idiopathic. Idiopathic means cause is still unknown. But then also we can say that if any students from MLT department, they do test, right? You know very well, MLT, how many MLT students are sitting here? Fine. So when you will do test, you will see that HLA-B27 is positive. That means this particular disorder is present in a particular patient, right? Next is rheumatoid factor is absent. If I talk about rheumatoid disorder means it's a joint disorder, and for that a gene that is responsible is HLA-DR4, right? I hope this discrimination is clear to everyone. Fine. Now next is, disease usually begins in the 2nd or 3rd decade of life, and if we compare the ratio of male is to female, that is 3:1 ratio. I hope this is clear, 3:1. Fine. Next. Etiology is unknown, but probable etiologic factors are genetic predisposition, as I have already told you, HLA-B27. Then the bacteria that is involved is Klebsiella, pneumonia, and some other enterobacteria. If I talk about pathogenesis, so I hope you know about pathogenesis. Patho means what? Patho means any abnormality or a disease. How the pathogenesis is done for this particular condition, right? So it is immune mediated and autoimmunity to the cartilage, that is proteoglycan aggregation. So I hope you know what is the basic difference between active and passive structures. How many bones are there in human body? Please buck up, student. How many bones are there? As you are a medical student, you should know these things. 206. And if I talk about how many muscles are there, then total there are 639 muscles in the human body. Out of that, 634 are paired. That means it is on both the side, that is right side and on the left side. And we have 5 unpaired muscles in the abdominal region. I hope this is clear. Now, if I talk about next thing, that is pathology. As you can see the bold letter, that is enthesis. Enthesis means the site of ligamentous attachment to the bone. As I have already discussed about active and passive structure, so I think you should know that our bones, they are termed to be the active structure, and ligaments, tendon, bursa, many things are there like cartilage, they are considered to be the under the category of passive structure. Means passive structure are those structure they hold our active structure. Fine. Okay, then next thing is enthesitis. So as the name suggests, enthesitis, wherever the itis is there, that means it is the inflammation, right? Now next is sacroiliitis. That means it's the inflammation of your spine. Now next. So synovitis means it is the inflammation and it will lead to the pannus formation, and after that fibrocartilage regeneration is there, and after that ossification is there. Means the vertebrae are fused and that will lead to ankylosing spondylitis disorder. Are you getting something? Students, are you getting something? Okay. Now next, enthesitis, osteoporosis. Osteoporosis means when the bone degeneration starts, like when the calcium in our body, it starts degenerating. It occurs at the age of 40 years basically, so it leads to the cracking of bones. So this condition is termed to be the osteoporosis. Then after that, when the calcium level is less, then it can lead to the vertebral fracture as well. Then next, it is spondylolisthesis. That means it is a intervertebral disorder again, which again affects your spine. And last, if I say that ankylosing spondylitis in one word, that means the other name for this disorder is bamboo spine deformity. I hope you know about bamboo plant. Bamboo plant everybody is aware of. So that means our spine, it becomes like a bamboo. Fine? No gaps are there. Our vertebrae are fused. You might have seen many old age people, they are acquiring this posture. So that is what spine are fusing, and it is leading to the disorder, that is your ankylosing spondylitis. So this is a pathology. As you can see, the normal spine, you can see the vertebral disc in between. That blue color disc is in between, right? If we see the advanced ankylosing spondylitis case, that means the disc has been compressed. So are you seeing the comparison between normal and ankylosing spondylitis case? Fine. So if we talk about the symptoms, what are the signs and symptoms for the disorder? So the very first is morning sickness, you can say, or pain in sacroiliac and lower back regions. Buttock pain, I hope you know your buttock area. Are you aware of buttock area? Which is the largest muscle in human body, if I say? Are you aware of it? Buttock means you know very well, right? So we have the most bulkiest muscle, that is gluteus maximus, that is present on your buttock region. And if we talk about smallest muscle, so that is our ear ossicle, that is malleus, incus, stapes. And the scientific name is hammer, anvil and stirrup. Now the next signs and symptom is lower back stiffness. When the patient wake up in the morning, then patient experience so much pain, right, within 30 minutes. Next is it can lead to chest pain as well, right? You must have heard about angina pain. Angina means pain is originating from the left precordial region of the chest. Next, stiffness and tenderness of the back muscle. Now you are aware of your back. Back is also divided into upper back, mid back and lower back. Next, bilateral sacroiliitis. It can affect on both the sides, as it is spine is involved, so both the lower legs are involved. Next, enthesopathies, that is pain in the site of ligamentous attachment to the bones. Iliac crest. Iliac crest, are you aware of iliac crest? We have a hip bone, and if we talk about the discrimination of the hip bone, so it is categorized like ilium, ischium and pubis. So basically the pain is on the iliac crest, trochanterus of the femur. Femur is the longest bone in the human body. You must be knowing that. Now, spinous vertebra of the spinous processes of the vertebra, costovertebral joints, extra articular manifestation, it involves usually eyes, affection, uveitis, that means inflammation related to the eyes. Then symptoms, pain in the different segments of the spine. Posture, it become like question mark because the vertebrae has been fused. Atrophy of the back muscle, when the muscles will not be used, it will lead to the atrophy of the muscles. Decrease thorax excursion, decrease articulation in the spine, that means there will be no articulation in the spinous processes. Then we have a cutaneous lesion that is involving to the postular psoriasis, and psoriasis is an inflammatory skin disorder, right? That is very advanced, so I am not going into much detail. Next thing, cardiovascular system involvement, that means the sign and symptom that is related to the heart. Aortitis, that means inflammation of aorta, and you might be knowing that aorta is the biggest vessel that what it does. What is the role of aorta? If you have studied the circulation of heart, you might be knowing about aorta. Aorta distribute oxygenated blood to all the parts of the body, right? Next, we have bronchopulmonary system involvement, then urinary system involvement, then gastrointestinal, that is, it is affecting the GI tract. So this is a question mark posture. That means when a person is affecting from the ankylosing spondylitis, the posture of the patient, it becomes like this. So it is also known as question mark posture, and the other name of the disorder is bamboo spine deformity. Now if we talk about the test, so being a therapist, as I am a physiotherapy expert, we perform certain tests for the diagnosis of this particular condition. The very first test is pelvic compression test, second is Faber test, third is Ganslin test, and the fourth is pump handle test. So if we talk about pelvic compression test, so it's very simple. When the patient is supine lying means when the patient is lying बिल्कुल straight, right? जैसे हम normally लेटते हैं. So what we are doing, what a physiotherapist will be doing, test irritability, they will be compressing the pelvis. And you know very well what is the pelvis area. If you compress that particular pelvis area, if the pain originates, that means the test is positive for this particular ankylosing spondylitis case, right? Next, if we talk about Patrick's test or the Faber test, Faber means flexion, AB means abduction, then we have ER means external rotation. So if I tell you about what is flexion, flexion means if I talk about just normal shoulder joint, We have so many joints in the body, right? So if I talk about flexion, so taking the arm up, that is flexion, right? If I am moving my arm like this, moving away from the midline, that is abduction. If I am moving it towards the midline, that is adduction. And if I am holding the arm like this, that is 90-degree abduction. If I move it like this, that is internal rotation. If I move it like this, so that is external rotation. So same way we have to apply for the hip joint. So this test is performed by having the tested leg flexed, abducted and externally rotated. Are you getting something? What I am talking about? Okay then, next is Genslen test. Next is lab test. So if I talk about lab test, I have already discussed with you people that for this particular condition, HLA-B27 is positive. And ESR is what? Erythrocyte sedimentation rate, right? That is also elevated, and CRP is also elevated. Mild anemia, that means the hemoglobin level is low. If I talk about the normal level, in some books or many places, the normal range is 12 to 14.44 gram per liter, right? Next is ALP and CPK is raised. If I talk about the treatment for this particular condition, if I talk about the treatment, non-steroidal anti-inflammatory drugs are given to the patient. That means they are painkillers. What does painkiller do? Painkiller is suppressing the pain, right? But on the other hand, we have so many side effects for the painkiller. So then physiotherapy starts and we have so many machines to subside the pain. Like if I talk about TENS, that is transcutaneous electrical nerve stimulation. What it does, this machine particularly, it inhibits the pain by releasing the natural painkillers present in the body, that is endorphins and enkephalin, right? On the other side, there is an exercise protocol, that is we have to perform at least 40 to 45 minute exercises in order to treat ankylosing spondylitis patients. So that's all for my topic. Thank you so much for inviting here. Thank you so much everyone.